So if you're in the middle of perimenopause right now, and you've got a lot of changes going on, and you're wondering, okay, what would be typical results that I should expect if I was to get some hormonal balance here? This is a typical case, and this is one that I just saw yesterday, and I'll probably see again today.
Introducing the Perimena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimena Bliss Podcast.
Hey, this is Doc Yates from Perimenal Bliss, brought to you by perimenalbliss.com, aohealth.us, and today I'm just going to go over another classic case. This is something that I just saw yesterday, and I won't be surprised if I see it again today. And I want to kind of go over what are the typical things that I see and expect when I'm dealing with perimenopause and hormone balance and the treatments for this. So I had someone come in, and when they first came in, it was about 2 months ago, and irregular cycles. So the cycles, they started skipping them. A lot of irritability, and what she was describing, it wasn't just she had always gotten some irritability with PMS, but it was starting to extend. It wasn't just PMS. Now it was like the whole entire second half of her cycle, and it was like half of her life at this point she was more irritable, and it was driving her nuts. Sleep disturbance had kicked in. Also, pretty much sleep disturbance all the time, except for during her period. And she was really struggling to lose weight. And here's the thing. She was already doing a low-carb diet Monday to Friday. She was already doing intermittent fasting, and she had started a new exercise routine, and she was working out very consistently. And despite this, the scale was not budging. So this will be a pretty quick episode because I want to tell you what we did and the type of results that she got. So we ended up doing a progesterone cream that she would put on her arm before bed. And in this case, she was using it from all the time, actually, in this particular case, but not during her cycle. So using it all the time, just not during her period. So she was to start it. Once she gets her period, she said the instructions were to stop the cream, wait till the period stops, and then you can restart the cream. And then there was capsules that we used. These are something that I had formulated. We call them hormone balance capsules. They're also called estrodom capsules. It's the same formula, two different names that we have. And one of them, so the progesterone was to bring the progesterone levels up. One of the biggest things, and I've talked about this before, but if you're a new listener tuning in, one of the biggest hormonal changes that happens during perimenopause is the progesterone levels have dropped enough you start getting symptoms of low progesterone. So your progesterone starts dropping at age 30. By the time for most people, by the time they're in their mid-40s, the symptoms start to become pretty dominant. And when I say dominant, I guess it would mean symptoms of low progesterone, and also in combination with elevated estrogen or normal estrogen, which means they have symptoms of estrogen dominance, symptoms of low progesterone. Now, the interesting thing about this case is that this client was not mid-40s. They were late 30s, and they were already getting all of these symptoms. So you can't really lock it in. Like if I had to pick the golden numbers, I'd say age 45 to 49, you're definitely going to be seeing it. But there's a lot of exceptions to that rule. Some people it starts in their 50s. Other people it starts in their mid to late 30s. So it varies. But when you learn to recognize those patterns, then you can adjust them. So hopefully you've been learning to recognize those patterns by listening to this podcast. So we had the cream going, we had the capsules going, and I said, don't do anything else. Let's not complicate this any more than we have to. You're already doing like a clean diet. You're already doing the exercise. Let's just see if this is kind of like the missing piece that's going to click this all together. And then I gave her a 2-month supply of everything, and to be honest, between that next 2 months, I just kind of forgot. I'd moved on to a lot of other clients, and she booked her follow-up because her cream was running out. It was time to check in, and here's what happened. Her cycle had become regular. So it had gone from skipping months every 2 to 3 months to now having a regular monthly cycle. Now, you could say that some people take that as good or bad. Some people, their favorite part about perimenopause and menopause is not having their cycle all the time. But you can't really argue the fact that things aren't moving back towards a healthy balance when you get having a regular cycle and it moves towards a regular cycle. So she had moved back towards a regular cycle. Her sleep was no longer an issue whatsoever. And the nice thing is that neither was her irritability. Her mood was so much better. And you can imagine how that would be twofold. So you do have the irritability from the hormonal changes, but you also have irritability from the sleep disturbances. Because once you start getting consistent sleep disturbances, your tolerance for anything will just drop dramatically. And that was the case for her. She had no tolerance for anything. And I think it was very frustrating for her because she was, kind of, I don't want to use the term lashing out, but she was getting very frustrated and irritable with her family, kids. She was having to bite her tongue in office meetings all the time. All of that was better. And she lost 17 pounds during those 2 months. And here's the thing. We didn't do anything different with her diet or exercise. I just said maintain that. And while she had struggled to lose any weight at all, now she was down 17 pounds. So I don't want you to think that, let's just balance my hormones and then the weight's just going to fall off. She was doing the work already, but the important point for this is that just doing the exercise and just doing the diet is often not enough if there's a lot of hormone imbalance. Especially when it's a low progesterone, elevated estrogen type case. And the weight gain will typically be around your midsection, and it will be a stubborn weight gain. It's not easy to get that off. So in this case, she got off 17 pounds during that 2 months, and I'm sure she'll continue to lose a little bit, though it didn't seem like she had far to go at this point. So, I hope this would kind of shed some light on the different things that you can expect to see when you balance the hormones. And here's the thing too, and this is a question I get all the time. How long, if I do this work to balance my hormones, how long do I actually have to stay on the hormones for? And the answer is, how long do you want the benefit for? Some of the benefit in this case, you could use it short period of time until the estrogen levels started to drop. And then at that point, you'd no longer be worrying about estrogen dominance, but then you're worrying about no hormones at all. And the no hormones at all doesn't correct itself on its own. So if you want to be able to maintain a healthy low level of hormones to improve your heart function, brain function, bone health, skin health, the answer is that use of these bioidentical hormones in a low dose works best when you just use it long term. So because that is a common question that I get, and people always wonder, do I have to use this forever? And it's like, well, if you want the benefits forever, unfortunately you do. But the alternative is not using it and then seeing an increase in all those conditions that I just mentioned. So in my thoughts, especially the way we have it set up, so it's almost like $1 a day for hormone balance. It's worth it. And the difference in the clients that I see that use it long term versus the ones that don't, it's pretty significant. But either way, I hope this case kind of helps shed some light on some things you can expect if you need to do some work with hormone balance. And I hope this was helpful. This is Doc Yates signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.